All right, let's talk about something you've probably heard of, but maybe don't know the whole story on shingles. We're going to peel back the layers on this virus, what it is, how it pulls off its disappearing act, and what happens when it decides to make a comeback.
So, to kick things off, let me ask you a quick question. Do you remember getting chickenpox as a kid? For most of us, it was that super itchy, can't go to school rite of passage.
Well, here's the thing. If you answered yes to that question, then the virus that causes shingles is, right now, living inside of you. It never actually left your body. It's just waiting.
So let's get into our first big idea here. The virus responsible, varicella-zoster, or VZV, is kind of like a character actor. It plays two totally different roles in two completely different diseases at very different times in a person's life. You can think of it like a two-act play. Act 1 is chickenpox, or varicella. That's the primary infection, the one we get as kids with that all-over itchy rash. But Act 2, that's shingles, or herpes zoster. And this is the crucial part. This isn't a new infection. It's a reactivation of the exact same virus from your childhood. Only now it's causing a painful one-sided rash, usually when you're much older. And this isn't some rare thing either. We're talking about more than 1.2 million people in the United States getting shingles every single year. In fact, if you look at the lifetime risk, it's pretty staggering. The CDC says about 1 in every 3 people in the US will get shingles at some point. So yeah, this is something that is very likely to affect either you or someone you know. So the big question is, how does this even happen? How does a childhood virus just go dormant for decades and then suddenly reappear? Well, the best way to think about it is like a sleeper agent hiding out in your nervous system. So here's the virus's game plan. First, it infects you, causing chickenpox. But once that rash clears up, the virus doesn't die. No, it retreats. It travels up a sensory nerve and hides out in the nerve ganglia, these little nerve clusters right next to your spinal cord. And there it sits, dormant, for your entire life. So what wakes it up? Usually a dip in your immune system's strength, often just from getting older or being stressed. That's the signal for the virus to wake up, travel back down that exact same nerve it came up, and erupt on the skin. And that's why shingles has that signature look, that one-sided band of rash. It's literally tracing the path of the nerve it's been living in for decades. So once that sleeper agent awakens, it unleashes a two-pronged attack, and it's defined by two main things: that very specific rash and often really intense pain. The rash itself, it follows a pretty predictable course. It starts out as red bumps. Then, over a couple of days, those turn into fluid-filled blisters. After that, they get a little pustular. And finally, after about a week or so, they crust over. And once they've crusted over, that's when you're no longer contagious. But for so many people, the rash isn't even the worst part. It's the pain. And the pain often starts even before the rash shows up. Patients describe it with some really intense words: a deep, burning, throbbing, or even a stabbing feeling. And there's a brutal physical reason for that pain. The virus is causing massive inflammation and something called hemorrhagic necrosis, which basically means bleeding and the actual death of nerve cells, right inside that ganglion where it was hiding. This is real physical damage to your nervous system. And for many people, this story doesn't end when the rash heals. This brings us to the most common and honestly the most feared complication of shingles. It's this lingering shadow that can stick around for months, or in some cases, even years. It's a condition called postherpetic neuralgia, or PHN for short. And the official definition is pretty straightforward. It's significant pain that just keeps going for 90 days or more after the rash first started. It is chronic nerve pain, plain and simple. And your age is a huge factor in whether you'll develop this. For folks under 60, the risk is around 5%. But just look at this. For people over 80, that risk quadruples to 20%, 1 out of every 5 patients. That jump right there is exactly why shingles is such a serious issue for older adults. This PHN pain isn't all the same either. It can show up in a few different ways. Some people get what's called neurologic pain, these sharp electric shock-like jolts. Others deal with neuropathic pain, which is more of a constant burning feeling, and sometimes numbness. And of course, a lot of people get a miserable combination of both. Okay, so that's the problem. How do we solve it? How do we fight back? Well, the good news is we have some really effective ways to deal with both the initial attack and that long-term pain. Now, for the acute shingles attack itself, there is one thing that is absolutely critical, and that is time.
You have a 72-hour window from when that rash first appears to start antiviral treatment. Hitting that window gives you the best shot at making the whole ordeal less severe and shorter.
The main weapons in our arsenal are these oral antiviral drugs. You've probably heard of them: valacyclovir, famciclovir, and acyclovir. They all work by doing one simple, crucial thing. They stop the virus from making copies of itself. That gives your own immune system the breathing room it needs to get the situation under control. But treating the chronic pain of PHN, well, that's a whole different ballgame. It's not a one-size-fits-all solution. Doctors actually tailor the treatment to the type of pain. So for those sharp electric shock pains, they'll often use gabapentinoids to calm down those overactive nerves. But for that constant burning pain, a different type of drug, tricyclic antidepressants, can actually work better to block the pain signals going to the brain. The whole goal is to target what's actually causing the suffering. And all of this brings us to one final big picture question. Shingles is really a disease of a weakening immune system, and it gets way more common as we get older. So, as the world's population continues to age, we are going to face a rising challenge from this reactivated virus. How we decide to manage it through prevention, early treatment, and just better pain management is going to have a massive impact on the quality of life for millions and millions of people. Thanks so much for joining me for this explainer.